Good afternoon, Dr. Bax, Professor Bax. Good to have you at the 13th annual Echo Horizons meeting. I wanted to hear your perspective. Over the last 10 years, there have been developments in the stratification of aortic valve disease. And more recently, you have important information emerging regarding moderate aortic valve stenosis. Could you elaborate, please?
Sure, I think it's a very important topic that you raised. So, over the recent years, it has become clear that even patients with moderate aortic stenosis are already at elevated risk, with a higher mortality and a higher morbidity. And so people have been thinking about what would be the possibilities to treat these patients earlier. And there are some pharmacological possibilities, but there's also the possibility to intervene with a transcatheter aortic valve replacement earlier and not wait until that patient develops a severe aortic stenosis but is already having moderate aortic stenosis and then considering to do a transcatheter aortic valve replacement. So this is probably is probably associated with favorable outcomes, but the point is that probably you need to have already signs of additional damage so that it's not just a valvular disease, but it's already beginning to be a ventricular disease. What does that mean? That means that if the heart has to pump against a valve that doesn't open very well, there's going to be fibrosis in the left ventricle. And the fibrosis, which is reflected in the hypertrophy, basically, of the left ventricle, that is already resulting in increases of morbidity and mortality. So if you want to intervene earlier, you have to be at a stage when it's purely a valvular disease and not yet a ventricular disease. So we are at the crossroads. Are we going to treat these patients earlier, or do we keep on going that we only treat severe aortic stenosis? Now, there are several trials on this. Medtronic has started a trial on moderate aortic stenosis, half of the patients transcatheter aortic valve replacement, and Edwards Lifesciences has started the other trial. The trial from Edwards Lifesciences is the Progress trial, and is looking at early valve replacement versus basically doing nothing. And I think if the outcomes are good, because there are big registries that show that already in moderate aortic stenosis morbidity mortality is high, as we just mentioned, and if the outcomes are good, that probably could prevent ventricular damage. And if you prevent ventricular damage, then probably the outcomes, when it's purely a valvular disease and you replace the valve transcatheter, then probably the outcome is going to be much better.
So to clarify, the study that you're undertaking, is this in individuals with preserved ejection fraction, middle ejection fraction, or reduced ejection fraction? And the reason I ask is a few months ago in the American College of Cardiology journal, a small study showed that individuals with LV dysfunction fixing the moderate aortic stenosis, i.e. relieving some of the resistance to outflow, showed positive outcomes. So the study you described is very timely, but if you can clarify for us if the group has preserved or reduced EF.
The group that we're targeting is the patients with preserved ejection fraction. And the patients that are being entered in the study having a moderate aortic stenosis, plus already a little bit secondary damage occurring. Can be atrial fibrillation, can be other issues, but there is already some damage occurring. Other issues like diastolic dysfunction being present, but you're still very early in the disease process, because if you wait longer, eventually your ventricular function, as you said, is going to go down, etc., etc.
We'll look forward to the results of this study, and it will be a game changer if it turns out to be positive. In fact, it is somewhat semblant of the early days of mitral regurgitation, where operating earlier spares the ventricle. This conference, Echo Horizons, also had several sessions on newer imaging modalities, i.e. speckle track or strain imaging, 3D volumetrics, and 3D imaging of valves to improve diagnostic accuracy, etc. Within your study, will you be doing some of these advanced imaging?
We're just sticking with the purely normal echocardiography, but the data, of course, can be post-processed retrospectively and taking into account the strain. Absolutely, yeah. But for the moment, we're just targeting the normal approach.
Excellent. Well, we look forward to those results, and thank you from Johannesburg, Echo Horizons.
Thank you.